I'm Dr. Chaitra, consultant pathologist, Shankara Cancer Hospital. If there was a single test to make a diagnosis of cancer, it would have been so nice and everybody would have been identified early and it would have been cured. But that doesn't work the way. So it requires efforts of all the team of doctors to make a diagnosis. So once you come with some complaints and then we examine, the clinicians examine you to see where the problem is and they do the physical examination. And then there will be various blood tests which are ordered and some can come high, some might not, but still it doesn't rule out there is no cancer. And then next goes the radiological imaging. So where the scans are done like X-ray, ultrasound, CT, PET scan. So all these things can say that there is some problem in the body like a mass or some abnormality, but still how is it confirmed? So biopsy plays a very important role. We can say biopsy is a gold standard in diagnosing the cancer. So let's see what the biopsy is. Biopsy means a small bit of tissue is taken from the place, either swelling or wherever it is abnormal, and is processed and processed to make a thin slices and seen under the microscopy. So what happens to this biopsy after it is taken? So it is sent to the lab for the examination. So it undergoes various chemical processing for it to be seen under microscope. So who sees it? We, the pathologist. Who are we? We are the special doctors who are trained to see these tissues and diagnose various diseases, either looking at the morphology and also by doing various special tests like IHCs or molecular studies to finally give the diagnosis. So many a times we make a diagnosis on the morphology itself. That is, when we put the slide, it is stained with a hematoxylin and indiosin, where the tissue looks pink and blue, and based on the morphology itself, many times we can come to diagnosis. But there are sometimes some situations where just the morphology will not help us. In such cases, the special studies like immunohistochemistry is essential to make the diagnosis. So on biopsy, what's the role of biopsy? One, as I told you, for the diagnosis, it is very essential for the diagnosis. So based on this diagnosis, this clinician takes us further step for the treatment. What are the options for the treatment? So the diagnosis is very essential to know what type of cancer is it. It's not just enough to say it is a cancer. There are various hundreds and hundreds of cancers. So it is important for the clinician, treating surgeon or the medical oncologist to know what type of cancer is it so that they can plan the treatment. So that, and also after the diagnosis, we grade them like grade 1, grade 2, grade 3. So that is the next information which we give on the histopathology. So, and then later on there are some parameters which we call it as prognostic factors, which are also included in our report. And also the IHC, that is immunohistochemistry, which is a special test. It helps in difficult cases, helps us to diagnose or confirm the diagnosis. And also there are some markers called as therapeutic, okay, where doing those markers, if they are positive, there are specific or targeted drugs for those cases. So that is also one of the important aspects.